I'm Neerav Goyal. I'm the Division Chief of Head and Neck Oncology and Surgery. So I'm an otolaryngologist, a head and neck surgeon, and really what my focus is taking care of adult and some pediatric patients and dealing with any disorder that's above the collarbone. So these are conditions in both pediatric and adult patients, can include cancers or masses of the thyroid or the saliva glands, includes anything that's kind of in the mouth going down to the voice box, and it also includes tumors that are between the nose and the brain. So a big part of what I do is reconstructive surgery as well. And so I'm able to take patients who have cancers that are involving the tongue, involving the jaw, and remove those cancers and then restore function so that I can see them after surgery once they're healed and they're speaking to me and they're talking about how well they enjoyed their meal with their family and their loved ones. For my patients, I see them for at least 5 years after we've done their surgery to cure their cancer. So it's amazing to meet them, visit after visit, remind them and reassure them that their cancer is gone, and also hear about their lives, hear about, weddings, grandchildren, and how they've continued to enjoy and, fulfill their lives. I think the amazing thing about Penn State Health is really how everyone here wants to work together to reach the primary goal of taking care of their patients. And that extends from our surgeons, our medical colleagues, the radiation doctors, to our nurses, to the staff that are walking the hallway, the transport team. Everyone is really aligned to help make the patients better. One of the things that really makes me remember how much I enjoy my job and what we do in our profession is when I see a patient who's finishing their treatment or has finished their treatment and they come up and they give me a hug. Or they come up and they start talking to me about how much they appreciate being cured of their cancer when 5 or 6 weeks ago, when they were before their surgery, they could not speak. They could not eat. And we were able to restore those functions. So that it is really amazing. It is very gratifying, and it reminds me how important our job is and how much of an impact we have on our patients.